Hello, everyone, and welcome to RevitalizeMD, all things aesthetics and wellness podcast with me, your host, Dr. Deborah Durst. So I have my usual co-host with me, and I'll let her introduce herself shortly. But we also have a special guest with us today, Tim Smith, who is the owner and operator and pharmacist at P3 Pharmacy, compounding pharmacy here locally. He is a wealth of information and experience, and he's our go-to for that information whenever we have any questions here at Revitalize. So we were lucky enough to get Tim to come on to our podcast today so we could talk a little bit about compounding.
Sure.
And different questions related to that. So Farideh, if you just want to say hello, and then we'll let Tim.
Hi, everybody. Farideh Golan-Bieski, nurse practitioner here at Revitalize.
Awesome. And then,
always.
Now I'm going to let Tim introduce himself. And again, I do want to hear a little bit about his experience so that you guys can hear that as well. So, Tim.
Absolutely. Well, thanks for asking me, ladies, to be a part of your podcast. I am fortunate to get to own a local independent compounding pharmacy. I've been doing that for about 11 years now, where we get to customize medication for you guys and working with local practitioners. I've had a wealth of experience in the pharmacy timeframe, bulk of that, 20 years of that in institutional practice. So that's hospital practice pharmacy. And then now I've transitioned as well as owning this pharmacy into academia. So I get to spend time educating future pharmacists and physician's assistants, nurse practitioners. So that's a delight and a joy for me to get to do, as well as get to work with these ladies and their patients and getting some customized medications to them.
Yeah. And Tim is, again, you're a wealth of knowledge. And if ever we have any questions, he's our go-to for sure. And it's so nice to have you locally, because otherwise you have questions and you're not quite sure how you would get answers if we didn't have you to go to for
Exactly.
them.
So sometimes we'll have some not so normal situations pop up, and he's just a quick text away, and we get a real quick response from you, which is great, and we really appreciate that. I know I really appreciate that, because usually that turnaround is so quick, and it's nice because a lot of times I can answer that patient's question before they even leave the office.
Yeah, I mean, you ladies segue into it greatly. We tell our students it's important to have a good triad of care, and the patient, obviously the most important thing, but having the practitioner and your pharmacist advocating for you, talking about what's best for you, is going to give you the best outcomes. By all means, every study represents that. So getting to answer those questions and work with you guys on your patients is a pleasure.
Yes. Yeah. Thank you. And then likewise, your communication with patients and then the feedback is amazing too. So the fact that they get, quick customer care, answers to all their questions and a very, intimate feel of the pharmacy when they're there, which again is just key to overall. I think my experience, like going to a regular pharmacy, has never been good, right? You get different people, different answers, and sometimes, not quite the answers that you want.
Yeah, absolutely.
And so I love the fact that patients can actually go in and get personalized care and answers. At P3. So.
Absolutely. It's a cornerstone of what we try to do. If you look at here at RevitalizeMD, it doesn't look like a normal physician's office. We would tell you that probably 100% of our patients come in, they walk in the front door and go, oh, this doesn't look like box store, pharmacy, whatever. No, and we're like, no, it doesn't. We're a lab. And we're designed to customize an N of one for each of those patients. That lab's producing exactly what you and your practitioner need for you to get the results. So we're not a typical looking pharmacy, and it's a challenge sometimes to get a patient to understand why. Why can't pharmacy XYZ do this medication? And we'll hopefully get to talk a little bit more about that today, if not maybe later, and understanding how that lab works and what is a compounded medication all about.
No, absolutely. And it doesn't look like the regular pharmacy. And then,
it does not.
Again, you have answers to questions for prescriptions, but also there's supplements there as well. So that if you have something that's being treated, you're getting your questions answered, and there's something that needs to be added to it. It's something that can happen right there as
Absolutely.
well.
And you guys have a consultation room.
And
So
yeah.
that is really lovely. So then it's not,
Mhm.
you know, like you said, it's not a typical pharmacy. You go to the pharmacy, you're at a checkout, you're paying, they're like, sign this line that a pharmacist has talked to you. And you're like, but hold on, maybe I have some questions, but they're just kind of like, go, go, go.
Mhm.
Yeah.
You know, you walk into P3 and it's definitely very welcoming. You've got awesome supplements right there that are great. You have your consultation room. So when you have questions, you really get them answered and you guys take the time to do it. And that's amazing.
Yeah, absolutely. I think that patient knowledge is paramount for them as they get on this wellness journey.
Oh, yeah.
If they don't understand what we're reading about in the literature and be able to ask questions back, we're not going to see the outcomes we're all hoping for. So it's a big part of what we do in the beginning to make sure they understand why that pharmacy has been selected, why compounded medication has been selected, and then now what do I expect over the next days to weeks to months as I start this journey in this therapy.
Mm-hmm. And that's where experience really, really helps as well, because you learn that, and the fact that you can teach younger pharmacists that are coming up and educating in their pharmacy programs and be able to apply some of that when they get out, because you know how difficult that is at the beginning of any career, right? You know, Absolutely. It doesn't matter what it is, you're a little nervous. And so again, being updated on literature in support of whatever's being done and prescribed, but also being able to apply experience to it and teach younger pharmacists to do that too. So
that's right.
So
absolutely. I think as a provider, our biggest thing is education with our patients on that. And those first few visits, we're going to see you guys a lot. As a lot of you know that are on hormones, it was not, here's your prescription, tomorrow you feel better. It is a journey. And there are a lot of changes. And we were talking a little bit about that prior to starting this podcast on how that education for our patients is so important. So when we are looking at pharmacists that we work with in pharmacies, we're looking for that education component. And you guys do a really good job of that, talking with those patients about the medication and that, like you said, it is a journey. It's going to be, you know, what is this going to look like in 6 to 8 weeks from now for some people, about why we're trying to tweak and adjust.
Yeah, absolutely. I think it's, you know, understanding that journey and then understanding that prescription that they just are picking up and what's the difference in that compounded medication versus something from a pharmaceutical company is a lot of times a big gap that we've got to close for that patient because it's not something we're used to. It's still a very small percentage of prescriptions dispensed on a daily basis are a compounded medication, even though year after year we see that line and it's growing as we see more patients advocating for wellness and reaching out for those things. And that customization, which we probably won't get to in depth today, but that customization of that prescription for you is going to produce fabulous results. And understanding in that background of what that compounded medication is about and how that's formulated is really important for our patients to understand.
And so one of the big things, and again, we get these questions all the time, and likewise, just answering like, what is compounding versus regular pharmacy or traditional pharmacies? And again, it is customized. So we can, and it's not just all hormones, although I think a lot of people think compounding pharmacy and hormones, but that's not the case. Other medications can also be compounded. But the reason we're doing that is because we can customize it to your care. And so it's not a one size fits all in traditional medicine. And likewise, the compounding pharmacy works well for regenerative, anti-aging, you know,
bioidentical
That's right. Hormone treatment. So inequality, you know, so you want quality when you're customizing this. And this is what we're going to talk a little bit about. So we can write a prescription. We can see somebody, decide what's right for them, which could vary. And so there's not, you know, I'm just going to send and it's always a 5 milligram, whatever, you know, a 5 milligram tablet. So you're going to get a blood pressure medicine. It's always the same. You know, that can be varied based on your needs, your laboratory interpretation. And so basically talk a little bit about, you know, how we can customize and not only forms, I mean, not only doses, but forms, delivery systems.
Yeah, absolutely.
All of that. So,
if we stay focused on hormones, that we can kind of talk on those dosage forms. I think probably the first thing you look back and you say, oh, Aunt Susie, right? Aunt Susie had a compounded medication. Most people would think of that as she has an allergy to something that's been prescribed and I can't take that any longer. So a pharmacist, the old apothecaries from the old days, which is what pharmacy was, they would make something that's doesn't contain that allergen. So certainly that's still a cornerstone of what needs to happen to take care, but that's a tiny amount when we look at bioidentical hormone replacement therapy, because what we want to do is leverage dosage forms, and the delivery of 3-4 different hormones can be quite different based on those routes of administration or dosage forms that we use to leverage those. If we look at drug in a body and drug out of a body, we tell our students that's called pharmacokinetics. And being able to leverage drug in and drug out therapeutically is important. And to give you an example of how we can do that, you swallow a tablet or a capsule by mouth, your stomach absorbs it, bloodstream, and then you get, typically most often you excrete that in the urine. We can change that dramatically by doing something topically. We can do something in females vaginally. We can do something sublingually, buccally, or we can even do implantable hormone pellets so that we get long release of drugs from the intramuscular sites. So leveraging different dosage forms is what we really put a lot of education into for you to understand why that dosage form, but in the background, can we deliver to the practitioners to get the results is important for us when we formulate those, because we can look at troches, which we would do sublingual. We can look at different topical creams and vaginal creams, and how we formulate those is super important to get those drug in and drug out of the body and leverage it best for a patient an N of 1. Whereas we look at a drug company, they're looking at N's of tens of thousands as they do that. This is customized exactly for you, that patient, that your practitioner says that they think is going to give you the best results. And that's really important in hormone replacement therapy.
And an N equals like the number of patients, to treat. So basically customizing for that one patient. And so, and troches, speaking of which, I don't want to get back to this conversation, but troches, we get asked all the time. Like they can't say it. And they're not sure what it is. Even our staff does the same thing. They're like, what is that again?
A troche?
Troche.
A troche, right?
Make it French.
So to even talk about a little bit about that in sublingual, absorption and delivery and how that's different from oral.
Yeah, absolutely. So if we go back to the example, I'll give you a swallow in a tablet or a capsule. Once it's absorbed out of the gut, it has an effect that we look at kinetically called first pass effect, which is the liver is going to metabolize some things before it's presented to the bloodstream and then delivered throughout your body into the tissues and those target sites that we're trying to get that hormone to. Well, if we do sublingual under the tongue where it's absorbed, so this little troche, think of it, we probably all remember back like a chiclet, right? A little thing that's going to melt in our mouth, or a little dinner mint. So that's going to melt, and we can control how fast or how slow that melts over how we formulate that troche. So we can have soft troches, kind of like gummies, or we can have real hard troches that melt slower. And we may want that to be a slower release in that sublingual space. The important part under the tongue is sublingual, is we don't get first pass effect. So we're able to use lower doses of drugs, which will limit adverse events typically that we see associated with higher doses that go through that first pass effect. So we don't deal with some of those same metabolites, adverse events that we would deal with, particularly by those by mouth administrations. So that troche route is very popular and allowing us to get drug into the body very quickly and efficiently, where it's a little bit slower process by the gut.
Okay. All right. Yes.
And there's one in particular we love to use here, which is a combination pill of sildenafil and tadalafil, so Viagra, Cialis combo. And again, it's a lot of guys will have a lot of side effects with higher doses of those medications. So it allows us to do a lower dose with a punch.
It's a great example in sexual wellness for men and women, where we see a lot of times the commercial products. A lot of patients have relative or absolute contraindications, those side effect profiles. I can't take that because. And where now we can introduce those same active ingredients, but just in a different dosage form, puts those back in play, if you will, where that patient then can tolerate those and then leverage that therapeutic result.
Yeah, it's awesome. Our patients love it.
Yeah, because then you can get, long acting and a short acting all at once, and
absolutely
formulated so that lower dose, and we'll talk a little bit more about that after. But lower dose with less
Yeah.
side effects, as you mentioned. So, so bioidentical is another big issue. And I think, myth, they're not quite sure what that means, right?
Mhm.
Bioidentical hormone replacement. And so since we're kind of talking about hormones when it comes to compounding, how maybe, that what that source is. And again, when you talk about apothecaries and old apothecaries, you made me think of the mortar and pestle and
That's
all
right.
that stuff, like going back to
Yeah.
that's where this
Mixing
is the
it
way
up,
we
making a
used
little
to do
slab.
it
Mhm.
before big companies. So we're
Yeah.
just doing it that way again, right?
That is
But
correct. Mortar and pedestals still exist today.
I know.
Yeah,
right?
we learn how to use them correctly.
I know.
We spend a lot of time teaching students how to do that, as well as electronic devices that do that same mixing processes. Yeah, but bioidenticals are a great example of us being concerned about how we source and how we get those ingredients, because we try to tell our patients when they come in, a cookie's not always a cookie, right? And you can make them different ways. And you can buy different ingredients, and that's the same thing for any compounded medication. But what's super important is the quality ingredients used at the start. If you don't start with high quality stuff, that end result's going to lack probably in the quality that you're desiring to get in that compounded medication. So being able to have the right data and then formulate that from quality, high quality source ingredients is step one. That's got to happen. And that's what we're committed to doing in all those patients. So it's a lot of vendors out there you can buy stuff from to compound with. And as a pharmacist, that's our job as your pharmacist to make sure we're getting you the best ingredient possible out there.
Yes.
Absolutely.
Yeah. Yep. And then again, because bioidentical, so we explain, that we're testing. So it's identical to what's in your body. So we can actually test and then replace and then retest and see where we are with that. And so that's, because again, we're not using a drug, and which is another reason why, FDA approved products aren't always available, because it's identical to the body and therefore has to be a little bit different to be patented. And so it allows us to get something identical and compounded and customize it for you, which compounding pharmacies are the only way we can do that.
Yeah, absolutely. There's those bioidentical, which, as Dr. Durst is telling you, that's chemically, if we draw out that structure, it looks no different. If you're a female and how progesterone's made by your body, that which we're weighing out on a scale, that powder, the chemical structure of it looks identical to what's in your body day in and day out. There are synthetic ones that don't. So you can, as a chemist, you can put little structures on there. Can you still get a similar result? Yes, but a lot of times it binds to receptors differently. You get different adverse event profiles than you might with something that's bioidentical. So that's going to get in the body, act in the body the way that it would endogenously if your body made it, and then exit out to get a therapeutic result. So that's a lot cleaner, as we like to describe, way to supply hormones than dealing with bulky side chains in synthetic hormones that you could compound with if you chose to. But we try to always offer those bioidenticals as that primary option, because we know it's going to mimic more at the receptor in the tissue, more of what normal physiologic responses would be.
Yeah, exactly. Absolutely. So we have less side effects, and we see that in our patients. Sometimes they'll want us to send something to a big box pharmacy, and we will, and they're not getting the results that we know that they should get from that medication. And we'll kind of talk through those and the side effects and what's going on. And maybe they agree to try a compound, and then we see way better results. They're sleeping better. The effects that we're looking for actually starts to happen, and they go, oh, this is why you wanted to compound. Oh, this, you see that light bulb go on and they get it.
And again, sometimes, it's really kind of how it's manufactured. Again, even those pharmacies that are manufacturing even a manufactured brand that you're getting at a regular pharmacy still depends on how it's manufactured and, and what company's doing it. And so sometimes if we don't see levels, and we always say there's going to be some goal levels we're going for and some symptom control. And so we're in touch frequently with the patients in that first 3 months for sure, tweaking sometimes based on a conversation, because we can't get levels potentially. Sometimes we'll switch them and see levels elevate, because if we don't get symptom say we don't reach the level, we have a goal level, say we don't reach that, but their symptoms are controlled. That's okay, depending on the balance of everything else with it. So, which brings us to when we're doing creams, for instance, especially at the beginning when we're seeing patients, we're compounding those creams separately. I know that you can put them together and sometimes we do eventually, but initially doing them separate so we can kind of tweak and get the levels up and down and all of that. And so maybe just talking about creams and how even absorption of the different hormones, through creams or even vaginal, and how it might be a little bit different than epidermal.
I think our biggest questions that we get is, how long does it take to absorb? What do I have to watch for?
And vaginally, it's always, is it going to be irritating? Those kind of things. So how we can make a vaginal prep a little bit differently.
Those are great questions. I mean, we get that constantly from patients. And first off, if you go back and you look at a topical cream and a vaginal cream, the formulation of those is completely different. So maybe some of the inactive things would irritate a mucosal lining like vaginal tissue. Whereas I can put on the top of my skin, if I'm going to use my inner forearm or my inner thigh as a topical application for a single, double, or triple hormone cream, that formulation looks a lot different. Why? So normal skin, its job is to keep stuff out. So me as a pharmacist, I have to understand the drug and its ability. We call it a diffusion coefficient. How easily does that drug move through the skin? If it moves through easily, it's an easier thing for me to formulate. Sometimes I might need to slow that down so it doesn't just go through the skin and out of the body real quick. Versus some things that don't get through the skin, I have to trick the skin. And I have to put it in a cream that will allow it to go through the skin, kind of like a Trojan horse. And it will carry it through that skin so that we can get it into the soft tissue underneath your skin. And then it's just pharmacology 101. Then it's like any other way I would deliver it to that tissue, whether it's by mouth, whether it's by injection. That cream works identical. The nice part about it, again, if you remember back a few minutes ago, we talked about pharmacokinetics. By going topically and vaginally, we a lot of times can avoid first pass effect again. Sometimes we want first pass effect. There's metabolites that you ladies like to get produced because in hormones, they have an advantage at receptors in tissues. Sometimes they don't. So that allows you guys options, and for that patient and you as patients to manage those symptoms, as you alluded to, being able to leverage between two dosage forms of both creams can be completely different. The absorption rates and what we normally see is dermal, just on the skin, can be a little more challenging to actually correlate with blood levels and how you're going to monitor. Is it saliva levels, blood levels, finger stick, capillary blood levels versus vaginal creams? That mucosal is a little bit easier to get drug across that tissue. So sometimes it's getting feedback from you guys and girls as far as what's working for you in symptoms, what's working best, what do you like, what do you want to use day in and day out to be compliant with, can be a big difference. When you alluded to topical stuff, it is important to understand if you're in a home with pets, small children, or spouses, we're dealing with potent chemicals. Hormones are considered hazardous drugs. So you put some on your forearm, and in that area of application, and typically we try to do like a 4x4 area of skin to get predictable absorption through the skin. If you have skin-to-skin contact with anybody for up to 2 to 3 hours, if it's Fluffy the cat licking your skin, or if it's your 2-year-old licking your skin, right, coming up, then you can transfer that with skin-to-skin contact for up to 3 hours afterwards. So it's important to understand, where am I going to apply it? How can I use that safely in my home? But in understanding, again, how I apply it so I get that right therapeutic effect that we're after in using that compounded medication.
Yeah, no, that's huge. Actually, transference is
one of the biggest things we
One of the
talk
biggest
about.
things, yes.
Mhm.
And I've had patients that have had dogs grow mammary glands with estrogen creams. So
Yeah.
Or women say their
And,
husbands
yeah.
have gotten really emotional.
yes.
Oh, yeah. Absolutely.
Like, what is going on with him? And I'm like, when are you using your cream?
Correct.
Absolutely.
And
Yeah.
again, transference of testosterone cream for men
Yeah.
That's right.
to women is a big
To their
one.
partners,
Yeah.
absolutely is a big issue.
Yeah, big issue. So that's absolutely important. And so yeah, the vaginal is definitely different. And then obviously, there's even some stuff that you have compounded vaginally that helps with dryness
Mhm.
that we love too. Combination non-hormonal,
Mhm.
in addition to, like, you have hormone options that can actually help. But if you're hormone optimized and you're still having some vaginal dryness, which you can
Yeah.
see with low estrogen, then you even have a product that I've loved. Like, our patients have had nothing but positive responses. And again, they're already hormonally optimized.
Yeah.
So having a non-hormonal, prep is awesome for that. So
That's the fun part
Mhm.
of being a pharmacist at compounds is working with practitioners like you ladies,
Mhm.
finding those therapeutic gaps. And then what can we create in the lab
Mhm.
that actually will fill that gap and give you something to take care of those patients? And this product you're talking about, this vaginal moisturizer, is just that.
Yeah.
Been able to leverage some normal moisturizers that we can do and put it into an elegant vaginal cream
Mhm.
has been awesome feedback from our patients in taking care of a common complaint is ladies' age of vaginal dryness.
Yeah, no, absolutely.
Yeah.
And
then
it's not always hormones, and that's important to understand. I think
Mhm.
a lot of times if women have any dryness, they assume it's estrogens off or a hormone imbalance, and sometimes it is not that. So
and
it's a good
sometimes I think
option.
it's a mindset. They get
Yeah.
fixated on the fact that maybe it is
Yeah.
because of age, where it could be just prolonged sexual intercourse,
Mhm.
other things. But again, our vaginal canal and, the ability to handle everything declines with age. And so having
Absolutely.
some other options is always good
Mhm.
so that you don't have to add other hormones
Absolutely.
to it. So in the lab is an important little term that I picked up on, because again,
Mhm.
the quality comes from
Yeah.
doing it in a lab type setting when you're
Absolutely.
actually compounding these medications
And staying
So-
clean and sterile. And I've actually done a tour of P3 and was very impressed.
Yeah. Yeah. I think it's something we take pride in. Our pharmacists and our technicians that are there take pride in that quality product. And we like to refer to it as batch control. We oftentimes, when we go out to educate practitioners that may not be familiar with compounded medications, what are you doing back there, right? Is it, you just kind of making concoctions, lotions and potions, what's going on? And it's actually very much a science. And as we go through and look at how do we make that compounded prescription, we can formulate it so many different ways. That's important for you to make sure your pharmacist understands how to formulate that to leverage it best for you and the outcomes that are needed. And when you get that formulation, that from batch to batch to batch, as you make that from one patient to 100 patients, that the variation of that is very, very narrow. There's not a lot of error that's moving from batch to batch to batch. If not, you guys will kind of see yourself chasing your tail, trying to
Mhm.
understand hormone levels or symptom management. And a lot of times it comes back to poor quality control in batch to batch as how that's being made by those technicians and pharmacists. That's super important to understand.
Mhm.
We validate that quite often ourselves with just independent companies testing. So as we finish those compounded batches, we'll send those out for assay so that we can make sure if it needs to be 100 milligrams of progesterone in a cream, that we're at that 100
Mhm.
milligrams of progesterone in that cream.
Mhm.
So we're going to always test that. That way we learn from our processes and make sure the equipment we're doing, the ingredients we're using, and then how our staff does that from batch to batch is given a consistent result so that you ladies then know, okay, if my labs don't look right, it's not that compounded medication. We got to figure out what else it is, because we
Mhm.
always, in healthcare, we're always suspicious of data and numbers, right?
Mhm.
Trying to understand false negatives and false positives and what's true data.
Mhm.
We're trying to eliminate a variable for you
Mhm.
that you can take out and go, no, I know that compounded medication's going to be consistent from batch to batch.
And it really does make it so much better for us. And
Mhm.
again, that consistency of
Absolutely.
we've kind of moved from, patient directed use of pharmacy to really a
Mhm.
standardized pharmacy for us, because then we know that that quality is there. And then we also know that we're in direct communication, which for me is key.
Absolutely.
If I think it's best for you as a patient, for your pharmacist and your pharmacy, because it's not just like we're always in touch with the pharmacist. Although if we have questions medically, we are, but our staff is in touch with your pharmacy staff too. So,
Mhm.
and that's how you want it, because if there's simple questions, we've had, patients need refills, and instead the patient's kind of texting or calling us because they have had trouble, the pharmacies had trouble doing the refills. We've never had that issue with P3 because, again, I think it should always be the doctor's office and the pharmacy and not the patients, working hard
Yep.
to get simple things done, right?
Yep.
And so that's key. The easier we can make it for you, the better. And so I think that if I wish that I had Tim when I was educating, because if we think about medical education, even and
Mhm.
prescribers that are writing, practitioners and prescribers that are writing get very limited education.
Yeah.
When it comes to
Absolutely.
drugs.
I read in an
prescribing
article over the
all of it.
weekend. It was like 4 to 10 hours over your program on compounded medications
Yeah.
total.
Well,
And I was
actually,
like,
even
that's
pharmacy,
crazy when you
though,
think of
like
that.
even overall pharmacy, not just compounding,
Yeah.
is like, I don't know,
A semester.
Like it's, because again, that was my undergraduate, and then going to med school, knowing that I did the pharmacy first and how little they did. And if I didn't have that as a background,
Absolutely. Yeah.
how limited I would have been in my learning. So
Mhm.
it's very little information is given. I don't know if that's changed at all, because I know you're working to educate, the pharmacy focused,
Mhm.
degrees and ones that are going to use it, like nurse anesthetists too are involved in. Yeah.
Yeah.
But medical, doctors and prescribers hardly get any. So again, I wish I had Tim, because he can, make it very simplified,
Yes.
in how you're going to deliver it, the difference between different things and why we do it. It's helpful because
Yeah, absolutely. I think the majority of practitioners, particularly ones that are naive to compounding, and they're just used to commercial stuff, and that's fine. It works for a vast majority of the patients. But all of a sudden, when you tell them the options that are available in customized medications, they go, "Whoa!"
Yeah.
Right? I didn't know I had that, because I thought I had one bullet to use to treat this one thing.
Mhm.
And you think, "Oh no, look, you can do so much more." And being able to get creative is fun for most practitioners. Most just don't understand that they have that as an option. And that's our job, to educate them and understand how they can do that. And that's the fun part for pharmacists, is to be able to engage that and get you to understand what's out there
Correct.
for you.
Well, and I think, again, if, primarily it makes it easy for patients to understand why we want to use compounding pharmacies, because we can definitely get the quality, but also customization for you. But likewise, if there's practitioners out there that need more education, you're not going to get much of that through your traditional pharmacies, where you will get a lot of it with, say, for instance, Tim. And so we're very lucky to have you locally, because again, it's a phone call away, or sometimes even a text, so that we don't take up your time, and you're quick in the response. And so it allows us to further customize. And when we have questions, again, do you do this? Can we do that?
That's right.
What about this? Is there an option for this? Because this is going on.
Yes.
Yeah.
And then even sometimes questions, about maybe whether, again, like a hormone being used vaginally is going to have an effect on a blood level of that. And, and so we can get really good information. So I really appreciate having you locally, for sure.
Yeah.
And I appreciate you being on. Do you think there's anything else that you would like to, some questions that your patients have that we might not have addressed, that would make it easier for anyone in the regenerative, anti-aging, hormone world using compounding pharmacies that, have that question over and over again that we might not have addressed?
I think we've done pretty good on it. I think, for the audience that's listening, be sure you understand. If you don't understand that, ask that practitioner, ask that pharmacist, so they can educate you. It's important, number one, that you know what's going on in this process, and that your education level increases along with everybody else as you go down this path of using a compounded medication. I'll be interested to see as comments and stuff come in after you listen to the podcast. If there's areas, I love talking about medications, right? Obviously, as a pharmacist, you would hope I would.
Yeah.
But as there's more comments come in,
Absolutely.
As more comments come in from the audience, we certainly maybe can do a focus on another one as we kind of talk a little more particular about certain types of hormone replacement therapies or other compounded options that are out there. It is a very wide and deep area of pharmacy that most people, as we've said, don't understand, but there are endless options. We try to tell our students it's a 360 degrees. You can go wherever you need to go to take care of that patient and be able to be creative. And in that lab setting is that fun part of being able to give patients options. Because some patients come to us, they're like, I'm exhausted. I'm so tired of this. I'm never going to feel better. And you go, trust me, you're going to be just fine, because we've seen hundreds and thousands of patients before you. And this option is going to work beautifully for you. Customized medication is, we talk to our students now, and in medicine, there's this buzzword of precision medicine that's out there. And compounded, customized medication fits in beautifully with precision medicine. And understanding what mom and dad gave you genetically. We don't all manage medications the same. And being able to alter those by you, that one patient, compounded medications give you that opportunity to do that. Whereas you can't sometimes in those commercial box prescriptions that are out there.
Yeah. And I think it's like, again, a one size fits all approach. One trick pony,
medicine we see,
but not only from pharmacies, but practitioners too, because that's traditional. Like we're taught, it's been promoted, so it's interesting to see a transition into more and more of not only regenerative, anti-aging, but compounding pharmacies and compounded medications, or supplements or vitamins. Even like there's all kinds of different options. So it is endless. What we can do.
I do think it's important. You had mentioned earlier a little bit about quality and a checks and balance. So I kind of just wanted to hit back on it, that with the company, you guys are setting out. So you are testing. There is that checks and balance there. So sometimes we'll have patients ask, well, it's not commercial. What does that look like? Do they have somebody making sure that they're following all the rules? So I think it's important for our patients to know that, yes, we do have, that you guys are having that checks and balance, that it is quality controlled, just like with a commercial big box company.
Yeah, absolutely. That quality is paramount. You can't put anything as a higher priority than medication safety. And we count that part of that quality control coming out of our lab is step number one in medication safety for patients and use of compounded medications. If not, it doesn't matter if you take it right or take it wrong. If we don't compound it correctly, you don't stand a chance as a patient with that medication. So
strictly regulated.
It is a very, very regulated part of healthcare. Pharmacy in general is, but compounded pharmacy and the standards we have to meet is quite extensive. Quite extensive. And rightly so, because there's a lot of risk out there for patients if it's not done correctly.
Absolutely.
Yeah, absolutely. And so I think one other question that we get frequently that we did forget is pellets. People always ask about pellets. What is it? What does it look like? So frequently we show them what it looks like. But again, how that's released over time, they're like, you don't have to remove it, those little questions. And maybe just hitting on pellets real quick, because that really does confuse them. Yeah,
absolutely. It's a unique dosage form out there for hormone replacement therapy. So it's an injectable pellet. So first off, it's sterile. So we have to worry about contamination issues. So if you're formulating those and you're producing those, compounding those, it's a different standard altogether. It changes the playing field when you're dealing with sterile compounding. But those injectable pellets are designed, they look, you showed them some, they look, I always refer to them as like a Tic Tac. If most patients will go, oh, okay, I know what a Tic Tac is. And it looks like a Tic Tac. It can be smaller or bigger Tic Tacs, but it's intended to be inserted into the gluteal muscle. And then we formulate it where that pellet, it's a very hard pellet, slowly dissolves over a set time frame. So the great part about it is compliance for patients.
Yes.
So you're not having to do something daily. Some people are okay with doing daily. Some cannot do that.
Mm-hmm.
And being able to have something that's done more in that every 3 to 4 month window is a great fit for patients.
Mm-hmm.
Where they
And
think they can do it daily and
they
very
think-
quickly.
Yeah.
That's not the best route for them.
Yeah, yeah.
Mhm.
And medication adherence is a problem for a lot of patients. And pellet therapy is one that really circumvents that adherence component and allows us to have predictable levels
Mhm.
as those pellets dissolve. And so it's a very unique dosage form.
Yeah.
Yeah.
Yeah. We do frequently get those questions. So
Yeah.
awesome. Well, thank
Is it going to
you
be
for
there
sharing.
forever?
Yes.
Does it have to be removed?
Yeah.
Yeah.
How did they
Absolutely.
come up with that? It's just
Yeah.
smart people. That
Yeah.
part
That's
is
right.
easy.
That's
so,
right. Yep.
well, thank you so much for being with us
Thank
today.
you for inviting me.
Thank you.
Yeah.
So again, Tim Smith with P3 Pharmacy. It's
Yep.
an awesome pharmacy here in Knoxville. And again, Tim is a wealth of information, and we so appreciate you coming.
Yeah.
And
Thank you,
speaking
ladies.
and answering some questions on compounding
Yeah.
medications and pharmacies.
Yeah.
Thank you, Farideh, for being
Oh,
here
you're so
again.
welcome.
Yeah. And again, remember to leave comments and any questions, because we can always cover things in a future podcast if we didn't get to it today. We would love to hear your comments and questions. And again, share, subscribe, hit the bell. And just remember, we're here to revitalize your look, your health, and your sex life. Thank you.